Okay, just so everyone knows, we're both recording and members of the public are able to join.
Good morning, everyone. Okay, I guess I'll take the silence as a good morning. No, I'm just joking. Good to see everybody. Sorry, I had the wrong link, so whoever just added me as a participant, thank you so much. We are at 10:01. Do we have a quorum? Can we get started, Terry?
Absolutely, we'll have Emma go through.
Very good. Well, then let me do the first order of business here, which is to call us to order, which I shall do, and ask that we do a roll call to establish quorum.
All right, I'll call the roll in alphabetical order. Please indicate if you're present. Ms. Cheatham joining virtually. Ms. Collins, they noted they are unable to attend today. Dr. Dixon. Here. Senator Doniate. I believe he's joining virtually.
He was not going to join.
He's there. I see his name on the list.
Oh, is he? Oh, did he? Okay.
Attorney General Ford.
I'm here.
I see he's here. Ms. Holmes calling from Carson City.
This is Shayla.
Mr. Iverson joining virtually. All right, Ms. Johnson, Las Vegas.
Present.
Ms. Lee joining virtually.
Present, and I would like to add that Chelsea Cheatham is here.
Great, thank you. Mr. Schoen in Carson City.
Yes, I'm here. Thank you.
Mr. Shell indicated he was unable to attend today. Assemblywoman Thomas in Las Vegas. Great. Assemblywoman Tolles.
Yes, I'm here.
Great. And Dr. Woodard.
Good morning, present.
Morning. Mr. Attorney General, we have a quorum.
Thank you so much. Well, again, good morning, everyone. Thank you so much for attending. This is, as you all know by now, a very active committee for a very active problem we have in our state. And it's great to see so many dedicated folks here. Thanks so much. Assemblywoman Tolles, I will unfortunately, I had to put you on the spot. I may have to go in and out, and I may have to give you the gavel on occasion, if you're okay with that.
Yes, sir.
Great, great. Thanks so much. Let's move on, which is public comment. We will receive it in person. The location is listed. Do we have anyone for public comment to discuss anything that's on our agenda today? Let's go with Carson. Anyone in Carson for public comment?
There's no one in Carson for public comment.
Thank you. Anyone in Vegas for public comment?
Yes, this is Debbie Nadler speaking for the record.
And if I can add, we miss Debbie Nadler as a committee member on the roster. She is here and present.
Thank you.
This is
Oh,
Heidi's answer too, and I think I was added recently as well.
You were, and actually, we're going to get you're on the agenda, Senator,
Okay.
So we can get you like officially on. So let's go ahead and go with public comment. Go ahead, Ms. Nadler. Were you going to make a public comment?
Yes, I was. I have a bunch of students who reached out to me from school, West Tech Academy here in Las Vegas, and they were very interested in starting a drug program in their school, which to me meant everything, having students reach out to me. They had gone to their principal. The principal said they don't have a drug problem, and they convinced the principal that they did. So I helped them put together a poster competition, and these girls have gone all out on this. They're doing it through their school. They actually formed their own group called Students Against Substance Abuse. They're going to try to get it in every school. And they're doing basically, I believe it's what Marion was trying to do with the DEA 360, which we no longer are doing. But my organization is donating money for first, second, and third prize. For the poster contest that they're doing. This is going to get all students, 1,500 students involved, at least to pick up a pencil and a piece of paper to look up something and make a poster. I was told at first by the Department of Health and Human Resources that they would donate a billboard. I told these teens that a billboard for the winning poster will be displayed throughout our city, because I think it would be a good precedence to kick off other school systems doing it and to get all schools involved. Now they don't have the funds to give me that. I have reached out to everybody in the community from Lamar, their department, to see if they could donate or do something. My organization's already donating $1,750 in prize money for the winners. And quite honestly, I lost my son, as you well know, to this epidemic. And I know our state is suing all these pharmaceutical companies on behalf of those suffering, but also on behalf of those lost. I'm not asking for a dime for myself. I've never asked for a dime for my son's loss. All I have asked and begged our state to do for the past almost 4 years now is to put education and mental health into our school classrooms to save our youth. It has been my dream. It has been my goal. I know it's what my son would want me to do. I don't even understand why for International Overdose Awareness Day that us grieving moms have to pay to turn the lights purple, $800 every year. There's something that is missing from this whole agenda that it dawned on me, and I should have realized it in the first place. What kind of composition do we I'm not using the right word, and I'm sorry, it's grief brain today. What kind of compensation is there for all the family members here who have lost a loved one from seeing I see a psychiatrist once a month and I have to pay out of pocket. Unfortunately, I have a husband who works. I quit my job because I can't work. I have such bad PTSD. I'm talking for the thousands of family grieving members. I'm not just talking for me. All we're asking to do is put education and awareness into the classrooms. We're not asking for money. However, there are grieving family members who are losing second, third, and fourth children due to this epidemic. And there are grieving moms who are committing suicide. I'm on every board across the country, and we have suicides from grieving mothers all the time. is there any kind of compensation, excuse me, that is provided for the families left behind? I see nothing. I know we're having education and prevention, and I know we're having treatment, and I know we're having resources, but and when you did the lawsuit against, and I have it written down here, when you presented the lawsuit against all these pharmaceutical companies, you specifically stated due to the deaths and the overwhelming losses in our state. So I feel like you're representing all of us, all the grieving moms. And I'm sorry for getting off topic here, but this school thing means a lot. It really means a lot. And I promised these girls a billboard, and now they're not going to have a billboard. So my husband's going to have to dip into his pocket once again after paying $40,000 for a funeral and $150,000 for rehabs, because he was failed in every single rehab. Because the very first rehab I put him here in this state of Nevada, he was turned on to heroin. He was addicted to Oxycontin. So if you could please help us get this into the school systems, help these kids at West Tech Academy. I don't even want Moms Against Drugs on the billboard. I want these kids to take pride in ownership of what they've done. I just can't afford to pull the money out of my pocket, nor should any other grieving family member have to do that.
Ms. Nadler, as always, we appreciate you being so vulnerable with your testimony with us. Thank you so much for speaking during public comment on this. Public comment, unfortunately, doesn't allow us opportunities to respond. It's simply comment. I will note, however, that you do have people on the screen with us in the legislature who I suspect are hearing you loud and clear as well. I think what we might want to consider, what you might want to consider doing is offline conversations around this issue. But thanks again for the public comment on that, Ms. Nadler. Okay, is there anyone else in Vegas for a public comment? No?
No one else here.
Thank you. Is there anyone online for public comment? I see a couple hands up.
Yes, we have just in order of how they've come up, Lisa Lee, and then Rhonda Fairchild, and then another online, Christine Payson.
All right, let's go with that order then.
Good morning, everyone. Lisa Lee for the record. Thank you for the opportunity to engage in public comment. I just wanted to thank everyone around the state for showing up as your best selves for our prenatal substance exposure learning series part 1. It was very well attended, and we had representation from all different kinds of professional and paraprofessional licensure, as well as foster parents, bio parents, and adoptive parents. So thank you for taking the time out of your day to engage in learning with us. I would also like to invite everyone present to our future prenatal substance exposure learning series part 2 and 3. Part 2 is a screening of the Wisdom of Trauma film. It is Dr. Gabor Mate, and that takes place May 17th. May is Trauma Awareness Month. May 17th at 5:30 p.m. I would be happy to send out the link, and I'll give you my contact information at the end of my comment. On May 18th and 19th, we have partnered, Washoe County Human Services Agency has partnered with the Arizona Trauma Institute, and we will be having Dr. Kamea Pekka train all of us looking at the impact of substance use in utero exposure. Also looking across a child's life course and how we can best support these children going forward. Again, if you would like to attend or interested in spreading the word, you can reach out to me directly at lclee@washoecounty.gov. Thank you.
Thank you, Ms. Lee. Who is next on the list of public comment?
Rhonda Fairchild, and I believe, Rhonda, I've unmuted you and you should be able to speak.
Thank you. Rhonda Fairchild for the record. First, I would like to thank everyone who attended our Black Monday There Is No Hero and Heroine awareness event, especially AG Ford. Thank you so much for coming. The community was thrilled that you were there and supporting the event. And then secondly, the SURG subcommittee assignments. I feel like we're missing criminal justice and reform. And I don't know if it's lumped into either the prevention subcommittee, treatment and recovery subcommittee, or response subcommittee. But I feel that it is a big enough problem that we need to have a committee just for criminal justice, Nevada Department of Corrections, or the jails, the parole and probation. It's a huge part of them being there is a direct result of substance use. So that's all I had. Thanks for letting me speak.
Thanks, Rhonda. I appreciate your public comment on that. Christine.
Good morning, Christine Payson with Nevada HIDA for the record. Just wanted to share that we at Nevada HIDA are working at getting the education out there to our youth. We've done a couple of presentations at some schools where a child was lost to overdose, and tomorrow and Friday, there'll be 4 different assemblies each day at the middle school where we had 5 children overdose and we did lose 1. So it's a big project. We're trying to get it out there. We're trying to get the message out there. Getting to every single school isn't realistic. So we are working with Las Vegas Metro Public Information Office and getting a video out. So it's a big task, but a little glimmer of hope. We are working on that education aspect. Thank you.
Thank you, Christine. And let me take a couple of minutes and for personal public comment and say, Rhonda, the event was fabulous. No Hero and Heroine, the Black Monday event. Thanks so much for including me. It was great to be there among so many of those recovering. Darren Waller had some fantastic testimony that evening, and if you've never heard him speak about his journey, you should tune in at some point. He's a football player, by the way, for the Raiders, in case you didn't know. And this past Saturday, I think it was Saturday, I attended another event and spoke at an event put on by the Seagulls, individuals who own the Westgate Resorts. It was called Victoria's Voice. Another great organization out there. The Seagulls lost their 18-year-old daughter a few years back, and they've created this program to work in schools, speaking of schools, but among other things as well. So there's a lot of activity going on out there. I'm glad to hear Christine in public comment likewise talk about what the HIDA folks are doing in schools. My son had a track meet yesterday, and I took him to it at 4:30. And as we were driving, my spirit told me to remind him that one pill can kill. One pill can kill. There are so many, opioid like substances out there that are laced with fentanyl, and they're killing folks. And we talked directly about high schoolers of his age and other parts of the valley here who have died just taking one pill, right? And so we have a lot of work to do. This group is an important one. And again, I want to, during my public comment, take the opportunity to commend us all for the work we're putting in. And we have a robust agenda ahead of us, and so we will turn to that. But let me do one final call for public comment. Anyone else? Okay, hearing none, then we will move on to the next agenda item, which is the review and approval of the minutes from our January 19th, 2022 SURG meeting. They were distributed previously, I do believe, but if not, you have them handy. Take a second and I will entertain a motion to approve those minutes.
Mr. Chair, this is Eric Schoen here in Carson City. I just have one correction. The spelling of my first name is E-R-I-K, not E-R-I-C.
Yes, sir. We will fix that. As someone who has a tricky first name, I feel you.
And having said that, I will make the motion to approve the minutes.
Thank you. It's been moved to have a second.
A second.
Who was the second?
We were.
Debbie Nadler, a second.
Okay, thank you. It's been moved and properly second that we approve the minutes. Any further discussion on this motion? Hearing and seeing none, all in favor say aye. Aye.
Aye.
Any opposed? Any abstentions? Motion carries unanimously. Thank you so much. Okay, next agenda item. Let me get back to my agenda here on my screen, and it is appointment time. So we get to appoint 2 new SURG members today. Senator, a good friend of mine, true to all that she does, and I'm so happy that she's been appointed to this committee. Well, recommended for appointment. We haven't done it yet, but Senator Heidi Severs Gansert, pardon me, to serve as a member of the to be appointed by the Senate Minority Leader, and Gina Flores O'Toole, Interim Executive Director of Ridge House, to serve the remaining term as a person who provides services related to the treatment of substance use disorders. Let me ask my my DAG on the line. Can I take both of these in one motion, or do I need to do them separately?
Rosalie Bordelot for the record.
Can I do both, or do I need to?
Yes, you can take them together if you like.
All right, thanks so much. I will entertain a motion to approve these new appointments.
Chair Ford, Lisa Lee for the record, I would like to move to approve both appointments.
Thank you. Can I get a second?
I second it, Debbie Nadler.
It's been moved and properly seconded that we appoint Senator Severs Gansert and Ms. Flores O'Toole in the respective capacities. Any further discussion on this motion? Hearing and seeing none, all in favor say aye.
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 Any opposed? Any abstentions? Motion carries unanimously. Welcome to the committee, Senator Severs Gansert and Ms. Flores O'Toole. We look forward to your dedicated service to this important committee. I think, Rosalie, can I ask them if they want to say anything under this agenda item before I move on to number 5?
Yes,
Okay.
they may make comments, just not go into deliberation on other issues.
All right, Senator Gansert, Severs Gansert, would you care to make any comments?
Thank you very much, Attorney General Ford. I'm happy to join. Assemblywoman Tolles asked that I help with this committee, and this is critical, right? The work that we're going to be doing here. So I'm more than happy to join and look at anything we need to do legislatively moving forward. So thank you for the opportunity.
Thank you. And Ms. Flores O'Toole, do you have any comments you'd like to make?
Yes, Gina Flores O'Toole for the record. I just am very honored to be on this working group and look forward to it. Thank you.
We'll move on to agenda item number 5 now, which is review and approve subcommittee members and chair assignments, roles, and responsibilities. And in this context, I'm going to give the mic to Vice Chair Tolles, who I'm certain heard during public comment a question about criminal justice reform and subcommittee assignments and whatnot. And I would ask, I'll put you on the spot, I'm sorry, but I'll ask that you, if you have any comment regarding that, feel free to mention it during this agenda item. So with that, mic's yours.
Thank you so much, Chair, and Jill Tolles for the record. Not sure if we have to do that formality in these meetings, but it's my privilege to lay out the plan for discussion and possible action in regards to setting up our subcommittees. We discussed at the very end of the last working group meeting that one of the ways that we can make this a truly working committee is to break up this enormous topic and extremely important issue in our state into 3 separate subcommittees. And those subcommittees entail prevention, treatment, and response. So prevention, let me just address the questions about what each committee is tasked to do. And in prevention, we always in all of these subcommittees want to include consideration of special populations. That will be a theme that will go across all subcommittees. And the prevention subcommittee will be focusing on basing a comprehensive view of prevention, including primary, secondary, tertiary prevention, including harm reduction, and is tasked with making progress on out of our actual bylaws specific items. And I won't go read through the entire list, but if you want to make note of it, specifically tying in items A and G, P and J, That's A is in apple, G is in grapefruit, P is in pineapple. I'll stick with the fruit, and J as in, we'll just say Jello. So that would be a focus on everything from leveraging and expanding efforts by state and local government agencies to reduce the use of substances, making recommendations to entities including the State Board of Pharmacy, professional licensing boards, licensed practitioners, et cetera, evaluating the effects of substance use disorders on the economy of the state, studying the efficacy, and expand the implementation of programs, something that we heard is near and dear to all of our hearts, but particularly in public comment from Mrs. Nadler. Thank you for always bringing in the mother's perspective. And in addition to that, there's going to be attention to assessing evidence-based strategies for preventing substance use and intervening to stop substance use, and examining qualitative, quantitative data to understand risk factors and study, evaluate, and make recommendations to the Department of Health and Human Services concerning the use of money described in the section 10.5 of this act. And so just bringing us back to the legislation that established this committee and how we're breaking out those tasks, that's what we'll find in the prevention subcommittee. And based on the survey that you all filled out in terms of your areas of interest, we have recommended the assignment of Debbie Nadler, Eric Schoen, Jessica Johnson, Senator Heidi Sievers-Gansert, and Senator Fabian Donate acting as the chair of that particular subcommittee. So with your permission, I'd like to go through the other subcommittees, and then we can open it up for clarification, discussion, and then potential action. So if you want to move to the next slide, the Treatment and Recovery Subcommittee is also, as all of the subcommittees, going to include consideration of special populations to make sure there's equity and access to treatment and recovery. And the items from our bylaws and the original legislation that would be included specifically under this subcommittee would be C as in cat, D as in dog, F as in fox, I as in, give me an animal.
Indigo.
Iguana. And J as jellyfish. So those would include, so with treatment and recovery, the pieces of the legislation that we'll be fulfilling in this group will be assessing and evaluating existing pathways to treatment and recovery. We want to see what we're doing today in order to be able to see where perhaps we could utilize those resources even more effectively, and then identify any gaps. D would speak to working to understand how residents of this state who are involved in the criminal justice system, which I know was brought up into the public comment, access supports for treatment of and recovery from substance use disorders. F would speak to examining the support systems and programs for persons who are in recovery from opioid use and any other co-occurring substance use disorders. Develop strategies for local, state, and federal law enforcement and public health agencies to respond to and prevent overdoses. And then finally, reduce the harms associated with substance use and substance use disorders while referring persons with substance use disorders to evidence-based treatment. And then there's, on top of that, some attention that will, for shared responsibility to us among all groups to assess evidence-based strategies for preventing substance use and intervening to stop the use, and then examining, again, qualitative and quantitative data to understand the risk factors that contribute to substance use, and then study, evaluate, and make recommendations to the Department of Health and Human Services regarding the use of money to address these issues. And for this subcommittee, based on your survey results, we have assigned Chelsea Cheatham, Dr. Leslie Dixon, Jeffrey Iverson, Lisa Lee, Steve Shell, and Assemblywoman Claire Thomas has agreed to chair if that satisfies the entire working group. And then the last subcommittee is, thank you, the Response Subcommittee. And This one is tasked with consideration for special populations, making progress to evaluate ways to improve and expand evidence-based and evidence-informed programs to treat and support recovery, recommend strategies to improve coordination between local, state, and federal law enforcement and public health agencies. And so this is a group that, as you can see by the list of the members, will have both health representation as well as law enforcement representation to speak more broadly about coordinating in our efforts to respond to substance use issues in our communities. Additionally, and I forgot my letters, but we have E, K, L, M, N, and O. And then with special attention to H and Q. So that first part, E, was the evaluating and improving evidence-based programs. K speaks to coordination between state, local, and federal law enforcement and public health agencies. L, it evaluates current systems for sharing information between those agencies in regards to trafficking and distribution of legal and illegal substances. Again, that law enforcement piece. M is study the effects of substance use disorders on the criminal justice system. So a deeper dive into that piece. N is to study the sources and manufacturers of such substances. And O is to study the effectiveness of criminal and civil penalties. And then with attention and shared responsibility to, again, addressing qualitative and quantitative data, looking at risk factors, and then making recommendations to the Department of Health and Human Services concerning the money from the opioid settlements and other funding streams. In this group, we have Christine Payson, Dr. Stephanie Woodard, Dr. Terry Kearns, Shayla Holmes, Gina Flores O'Toole, and then I have agreed to be the chair of this subcommittee. And if you can turn the slide, I'd like to just briefly talk about the roles and responsibilities of the members of the subcommittees, as well as the chair. And so let's start with, mine is in a different order. I'll go with the chair responsibilities. So the chair of each subcommittee, we'll stick with the chair. The chair of each subcommittee obviously sets the meeting agendas. We have proposed that these subcommittees would meet monthly so that they would have at least at a bare minimum 2, but if possible 3 meetings in between our large working group. And that the subcommittee chairs would help along with our consultants and other members. And Dr. Stephanie Woodard has also agreed to help. And I know that we have interested parties outside as well to identify and then make selections of who the subject matters experts would be to come in and present to those subcommittees on the specific issues that we'll be addressing. They will also solicit recommendations from the subcommittee members that will make up our final recommendation report at the end of our annual project with this working group. Facilitate decision-making process on the recommendations and facilitate stakeholder public comment. So let me just translate that to layman's terms. So essentially in every one of these working group meetings, the idea is to initially hear from subject matter experts, study a deeper dive into the specific role of your subcommittee, and then solicit recommendations from the members of that subcommittee. And we'll go through the template that you can utilize to help with that process. And after you get recommendations based on evidence-based best practices, based on the subject matter expert presentations and any other material, supplemental material, then go through a process with the working group members to either edit out which ones might be redundant, vote down which ones you want to save for later, or decide not to utilize, and then vote in the ones that you want to make into your final recommendations to the whole working group. And then the entire working group then will come together in a subsequent meeting and finalize as a whole working group which recommendations we want to include as part of that state plan at the end of our process, and then facilitate stakeholder public comment. And if we can move to the next slide on subcommittee members' responsibilities. If you have signed up to be a member, we would ask that you would attend the meetings or communicate with the chair if you're unable to do so, to actively participate in reviewing the material, making other suggestions for subject matter experts if you find good material for us to consider, and then provide recommendations that will be voted on and discussed in those subcommittee meetings. And if we can switch to the template, I want to walk through, and hopefully you can see that on your screen. It has also been provided on the website for this committee to be able to download that PDF as well. But we certainly, each chair can modify according to what works best for their way of collecting and receiving those recommendations. But in several working groups in the past, I've seen that using this template has been very effective to be able to organize all of the recommendations. And so what you see before you is a template that would be sent out to each subcommittee member and then returned, filled in with the subcommittee members' recommendations. And these, the columns help us organize which sponsoring member submitted the recommendation, what the recommendation is, which part of the legislation this satisfies. And so that's why I read through all of those letters. We could certainly satisfy additional ones from the legislation, but we want to make sure we're being held accountable to the statute that we're fulfilling the roles of this committee. And then any other including special populations across the board. And then any justification, this is the chance for the member to be able to explain how this recommendation falls into meeting the tasks of this subcommittee and really their best reasoning for why we think this will be most effective. And then any research or links, whether it's a model program from another state, whether it's a scholarly peer-reviewed journal article about the efficacy of a program, whether it's a sample of a website of an agency or a resource that's available, that's the opportunity to put that into the research and links. And then any action steps that would come from this recommendation. So this body is tasked with making recommendations as we know of how to spend any federal and state and opioid settlement dollars. But it also may lead to legislative bill draft requests, and or it may lead to some sort of other community outreach program or an additional utilization of our current agencies and resources available in this state. So this is where we would tie in where this recommendation will land as we envision it when it's ready to go to action. And then we also want to identify if it's a short-term or a long-term solution. Is this a one-time, one-shot funding, for example, or is this a legislative change that we see permanent? And then is there any fiscal note that would be attached to it? We want to identify that as early as possible, because obviously if we're going to be recommending any kind of legislation that may need to show up in the governor's recommendations or in the budget, we want to be conscious of that ahead of time. And then the last column you'll see is set for members' comments and feedback. And that's just an interactive way for other members to be reviewing the recommendations of the rest of the subcommittee and put their notes as they discuss it or before the meeting if they have any feedback or suggestions. And I believe that is the end of those examples and that presentation. So if we may, Chair, open it up to discussion about the roles and responsibilities of each group, the membership and the chairmanship of each group, and then any questions about the process.
Absolutely. I do see Lisa Lee has her hand up, and let me go to her first.
Thank you, Chair Ford. Lisa Lee for the record. I appreciate you entertaining my ongoing curiosity. Assemblywoman Tolles, thank you so much for sharing that tool. Actually, that resource has come in handy for the Interagency Council on Homelessness to Housing. So thank you for that. My question really is, I know that the responsibilities in Article 3, Section 1 is outlined in AB 374, including special populations in letters C, A through G. But I did just want to include this in public record that I do see a ton of stuff related to law enforcement. What I don't see, with the exception of item CF, which is children who are involved in the child welfare system, and also CC, pregnant women and the parents of dependent children. I think child welfare is a huge component of this system's approach. And I just wanted the record to reflect that there are changes, obviously in 2016 with CAPTA and CARA, and also the Families First Prevention Services Act, which allows child welfare agencies to go upstream and really kind of revamp systemically our system of care to include more upstream interventions for families. Given the data in our state and across states that show parental substance use and prenatal substance exposure to be a huge factor with child welfare involvement, I feel it necessary to speak on this. The other part that I had questions about is letter C. G just says other populations disproportionately impacted by substance use disorders. Again, I feel compelled to say that statewide, our data, and this is reflected in national data as well for fatal drug poisonings, that there is a lot of racial disparities that I think we would be remiss in addressing. And I'm a little disappointed that racial justice with regard to the drug war and fatal overdose fatalities, as well as the criminal justice system, we see racial and ethnic disparities across these systems and in our death data. And I really want to be cognizant of that fact here and be mindful of strategic interventions and intercept points within our system to be more, to address those racial disparities.
Lisa, before Assemblywoman Tolles responds, let me see if I understand the question here, because I'll say to you, I've heard comparable requests and concerns and questions from members of the community, including former Senator Patricia Farley, specifically concerned about children and the welfare of our government, and Senator Pat Spearman speaks specifically to the racial issues that you've addressed. Is there a specific recommendation that you're making that you don't see present? Think on that before you answer that, because I want to see if Assemblywoman Tolles has a response where maybe this is covered and we just don't see it. Go ahead, Assemblywoman Tolles.
Yes, thank you. And also want to open it up to any other member who would also want to point out the answer to that question. But I really appreciate Lisa Lee, Ms. Lee, putting that on the record and making it abundantly clear, because we can very quickly gloss over the phrase including attention across the board to special populations without further elaborating on the importance of exactly the human beings that we're talking about. And I would also like to reiterate that I think the point about children and families impacted is absolutely part of each one of these. For prevention, we know that, like you said, when you have parents that are using substances, the chances that the children will then be exposed or potentially fall into those same patterns. So the prevention piece would absolutely focus on that, treatment and recovery as well, and how how we address questions around what do we do when the parents are in recovery and who's caring for the children. And then same thing with the response in regards to your point about law enforcement and the criminal justice system. How are we addressing children whose parents are incarcerated in response to these issues? And so I appreciate that point. And then also the racial disparities, that is written throughout the law, that in each one of these, that we are examining that data and that we are addressing that in everything from prevention to treatment to the response portions of that. But if anyone else would like to chime in on a specific, language that we're missing or something that we haven't caught in here, please feel free.
And I would say this, not that anyone on the screen needs me to vouch for them, but I happen to have worked with every senator, every person on the screen who's in the legislature. I know they absolutely have a dedication and a sincere dedication to addressing the issues you raised, Lisa. I know it. I mean, I've worked with them. I know them. And it seems to me that we need absolutely to be deliberate in our mention of these items. And so maybe it's in the woman's toes. I understand that these things run through, they kind of permeate the entirety of all we do, but maybe it is imperative that we delineate specifically that we will focus, or each of these committees will have a focus on the items that she's mentioned, so as to make it clear, because I'm confident that even though it's unwritten, it's going to happen because it's been written throughout the entirety of what brought us here in the first place. That said, Lisa, let me go back to you to see if you have, if your concerns are allayed. Clearly, we want to remove any disappointments because the purpose of us being here is to try to come up with some recommendations that we can make to the resilient committee on this issue. So do you have a response to any of that? Are you satisfied with what you've heard, or do you have a recommendation on something that's going forward, or talk to me?
Thank you, Chair Ford, Lisa Lee for the record. I do believe that we do a lot with language, and I think it's important to be intentional and direct with language. So I would appreciate some more direct language, especially related to defining special populations. We know that the LGBTQIA+ community are also disproportionately impacted, as well as BIPOC communities. And I personally, I appreciate direct language that specifically calls that out, and that there's adequate representation within the language, and you don't just have to read between the line. The second part is CE. I'm noticing it says intravenous drug users. I thought we'd change that to people who inject drugs, and we're using people first language.
Let's fix that, please. All right, so I will. I have a thought. It's in the woman's toes, though. Anything you want to say?
Yes. So something that we could do to be more specific is in the template that we're working off of in each of those working groups. And I'm so glad to hear that it's already been beneficial to other work in our community. We do have a section on special populations, but we could add more specificity to that to ensure that it is ever present before us. Right now, we have letters, but we could actually list out so that it's constantly explicitly clear that that needs to be top of mind, and that we are responding and tying our recommendations back to how are we addressing the needs of all of these members of special populations.
That was my thought. Essentially, I hate to say it like this, copy and paste from the document, that because you mentioned LGBTQI, that's in the document. We can copy and paste that into these particular phrases there. I think we should be able to do that with no issue. So if it's okay, I would like to commend that. I'm reading your comment. let me actually say something though, because I know Rosalie got on me about this last time. We didn't mess up, but if we're putting stuff in comments, y'all, we got to say it out loud. Okay, because this is a public record type thing, and we don't want to get caught up with stuff in our comments that don't make it to public record. But to your point, Lisa, thanks. You always feel like a pain in the patootie, but it matters, and it does in fact matter, which is why we're bringing it up. So no fret there. So are we clear then? Lisa, are you okay with what our solution is here? Okay, you're shaking your head. Yes, that's an affirmative in that regard. Okay. Any further comments from anyone else on this? By the way, Jill, fantastic job. I mean, really, really fantastic job of putting this together. I am not surprised, but as always, pleased with the work you put in on this. I think it's going to be very beneficial. Any other comments on this?
Chair, we have some comments down here in Vegas.
Okay, I can't see who has hands up, and so go ahead.
Deb Nadler.
All right, go ahead, Ms. Nadler.
Yes, hi, Debbie Nadler for the record. I see everything in here in all these subcommittees. Is there something specifically in any of the subcommittees that provide services to the victims of the loss of their family member, mental health, the trickle effects, the domino effects? We don't have any kind of grief support in our city. I know we don't in Las Vegas. Not sure about Northern Nevada, but there should be some kind of victim compensation, something somewhere in these templates for the losses. I don't know.
May I respond?
I mean, something.
Chair, may I respond?
Yes, please, go ahead. And do identify yourself for the record. We have to do that for the people taking notes.
Thank you. Jill Tolles for the record. And Ms. Nadler, again, I was moved by your comments in public comment at the beginning, and I appreciate being able to come back to those comments. That is exactly what this committee is for, is to provide recommendations such as that. So that could be a recommendation that could land in any one of those subcommittees, but certainly in the response subcommittee group, I can commit to you that we will have that conversation as a recommendation. I know that you're on the prevention subcommittee. There certainly could be some application there, and then possibly treatment and recovery. So that's why we break into these subcommittees, so that we can really drill down on our recommendations in each one, but then we will come back together as an entire working group to make sure that we haven't left any gaps. And so so the reason why this exists is to make recommendations just like that, and then have a discussion about how practically that could work.
And you read my mind. That's exactly the response I would have made. I think the recommendation component is important here. If Ms. Nadler, a recommendation that comes out of the committee is compensation components you're talking about, it's going to be important that we, as Jill said at the very last part of her statement there, I'm paraphrasing, have some form of concrete recommendation that goes, right? What are the parameters? How do you determine who gets what? Recommendations, though, right? At the end of the day, we don't want to just give the Resilient Committee a list of stuff with no practical application or no ability for them to be able to discern how they can incorporate or accommodate our recommendations. So you should be thinking through those things as well. In the subcommittee, that's where the work's going to take place. Anything further, Ms. Nadler, on that issue?
Nothing.
Okay. Anyone else?
We have another.
Go ahead.
Yeah, Jessica Johnson has a comment.
Hi, thank you. Thank you, Chair Ford and Assemblywoman Tolles for putting this together. I hope you can hear me okay. I have a little bit of a cold. Okay, terrific. I was just making a reflection on the prevention subcommittee I was jotting down the letters and I caught the letter G and just noticed from the SURG roles that we didn't necessarily have anyone with immediate medical background. And it seems that if we're going to cover the recommendations around letter G, particularly with the licensing boards and practitioners, that I don't, I mean, obviously we can bring in subject matter experts, but I'm wondering if there's any movement or opportunity for anyone with medical background that's on the SURG committee to be considered for the prevention subcommittee as a way to address letter G. I just wanted to bring that up, given the makeup of the current subcommittee. Thank you.
My preliminary response is that's probably an easy fix. If we have someone who wants to join that committee who fits that qualification you just mentioned, Jill, they can join it, right?
They can. They would most likely have to, sorry, Jill Tolles for the record, they would most likely have to be a volunteer who'd be willing to serve on 2 subcommittees, which is always an option for individuals. But if, we have healthcare providers, we have a limited number of members that we had to divide between the committees. We could move someone from the treatment and recovery subcommittee, but then we might be losing a healthcare provider from that group, or open it up for somebody to serve on 2. And my initial response was, and that's where we will work with stakeholders in the broader community and with subject matter experts to, to be able to provide input and expertise in regards to those decisions.
So for the record, Eric Schoen, I myself am a treatment provider. I've served on the board of examiners for MFTs and CPCs for 12 years until I termed off just recently. And my agency provides treatment as well, both mental health and substance use disorder treatment. So if that's a comfortable approximation, I think I can fill those shoes a little bit.
Okay. Thank you. I see a hand up against that. Oh, hold on. Let me finish, Ms. Nadler. I think that's you, but let me finish with this point. Does that satisfy the inquiry there? Who's that, Jennifer?
Jessica.
Thank you, Jessica Johnson, for the record. It was just an observation, I think, of committee makeup, and just wanted to share that with the group as we're, determining sort of how to vote on this moving forward. So thank you for the opportunity, Chair.
All right. Thank you. Before Ms. Nadler goes, is there anyone else in Vegas who hasn't spoken yet? Yeah, go ahead.
Dr. Leslie Dixon for the record. I'm not volunteering to be on 2 committees full time, but geez, with the things about licensing board, I have lots of experience with the medical board, so I could probably serve as an advisor on that issue.
All right, duly noted. Ms. Nadler, and then we'll open it up to the broader folks. Go ahead, Ms. Nadler.
Thank you, Debbie Nadler, for the record. I have a mom who wants to work to help us on the subcommittee. She is licensed. She taught in school. She's got her psychiatry degree, mental health, everything, and she'd be more than willing to help us if we break into subcommittees and we can bring somebody on. That is her specialty. Just a recommendation.
Okay, why don't you provide our information to Terry, and then let's take a look at what our parameters are for bringing in external folks. I'm not saying we can't. I don't know. I don't remember off the top of my head.
Okay.
Give your information over to Dr. Kearns, and we'll take it from there. Any further comments on this from anyone else? Okay. So this is a possible action item, and I think we do need to take action by a vote to approve the subcommittee members and chair assignments, roles, and responsibilities as amended per our discussion. I want to be clear that Assemblywoman Tolles, as the person who ran all of this, understands what the amendments would be, so that you can accommodate that in the writing or whatever is necessary for purposes of formalizing these committees. Am I right about that?
Yes, just to clarify, Jill Tolles for the record, what I heard was we would add the specific categories of special populations from C, A through G into the template so that they're ever present before us. And then with the discussion in mind as well on continuing to include children, and then any disparities in treatment or any equity issues across all subcommittees. But specifically, we would add the C, A through G to the template.
Yes, and then Dr. Her name just escaped me, volunteered not to be a permanent member on 2 committees, but willing to have her name with an asterisk on the committee that was raised by Jessica. Am I right about that?
Dr. Dixon. Dr. Dixon.
Am I right about that, Dr. Dixon?
Yes.
Okay, with those amendments, I will entertain a motion.
Chair, just briefly, I'd like to also add an amendment that, and I thought I referenced this, but I don't think I made it clear that Dr. Stephanie Woodard has also offered to make herself available as an advisor to all of the subcommittees as well.
Oh, perfect, perfect. Okay, with all of that said, I will entertain a motion to approve the subcommittee member and chair assignments, roles, and responsibilities.
Stephanie Woodard for the record, so moved.
Okay, have a second?
Jill Tolles for the record, second.
Very good. It's been moved and properly seconded. Do we have any discussion on this motion? Hearing and seeing none, all in favor say aye.
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 Any opposed? Motion carries unanimously. Again, great job, Jill. Great job with you and your team. Moving on.
Chair, if I may just take one little point of privilege, Jill Tolles for the record, this would be impossible without our team of consultants from SEI. So they have put a tremendous amount of work in taking these and then materializing them before you. So I have to give credit where credit is due with all the support that they're providing to us as an overall working group, as well as their commitment to work with each of the subcommittee members. I know I can say with absolute assurity, we would not be able to have this high of quality if we hadn't had their support. So thank you.
That's great. Absolutely. I agree. That's actually an umbrella compliment for everything that's going on here. Thank you so much for our consultants. Okay, so we can move on to agenda item number 6 now, which is to review the updated findings and provide feedback for statewide needs assessment for the advisory committee for Resilient Nevada. I had to take a breath. I couldn't say that in one sentence. All right. But my apologies. Who am I tendering the mic to for this discussion?
For the record, it's Courtney Cantrell from Mercer.
There we go. Courtney Cantrell, Kathy Nichols, and Jordan Bublik. Okay, very good. Go ahead.
All right, thank you. So we're really excited to be back today. And as one of my coworkers just chatted with me a minute ago, it's great to hear the conversations that you've been having, the work you're doing, because we feel very confident that we've covered the kind of things that you're most concerned about. So it's really great to have been able to listen in on that a little bit. All right, next slide, please. And as a review, the state legislations, I think it was Senate Bill 390, required the state to do a needs assessment to develop recommendations that the committees will then turn into a state plan for how to spend some of the Resilient Nevada funds. So the first thing we're going to do today is review the feedback that you guys gave us in January. Then we're going to go through the needs assessment report update, just letting you know a little bit about what we've been doing since we met you last, and then we have a little bit of time for questions.
Thank you. Go ahead and proceed. I'm going to actually give the mic to Jill Tolles for a second. Okay, I'll be back in a little bit, but not the mic, but the gavel. I'll be back.
Thanks. So first, the initial feedback we got from you guys. So next slide. This is basically a summary of the January ACORN and SURG meetings. We didn't, for the sake of the slide and for the sake of brevity, we didn't put a bunch of details about the kind of things you recommended, but we wrote them all down. We looked at them. We made sure that we wanted to include made sure to include those into the report draft that we're working on right now. We're actually finishing up the very last bits of our first draft, and it is a long report. So please don't doubt that anything is going to be missing. We feel like it's pretty comprehensive. So we did get feedback from you guys and from the ACORN committee that there are additional areas outside of what we had presented that you thought were very important, including that regional level data stratifications, primary care and continuity care, basically expansion of MAT availability in some of the federally qualified healthcare centers and the rural health centers. Mental health disease specific rates. You wanted to see some rates on comorbidity between opioid and particular diseases. You wanted to see more about juveniles, youth and adolescents with substance use and opioid overdose rates and risk factors. You also wanted to know a little bit more about what we found related to childhood trauma, harm reduction services, educational resources, of course, for the conversation at the beginning, and then accessibility of care when it comes to time and distance, looking at the system from those perspectives. So next slide. Okay, and next slide, please. So now I want to move into the report breakdown. What you'll see in a moment is all those, that feedback that I had just listed will all go into the report, and we've tagged in this little presentation where it's going to go, so where you can see it once it's finished. But the first section, of course, is our background. Then we have our methodology. Methodology is basically kind of what sources we used, how we did it, as well as there's some kind of scoring of recommendations I'll talk about in another couple minutes that we're going to go over in the methodology, exactly how that was done. Opioid impact, that's going to be like the levels of opioid use in the community. Then we move on to polysubstance co-occurring conditions and suicide impact, risk factors, best practices for opioid issues, and then recommendations. Now, those are the 7 sections, like big buckets. And then each of those in itself is going to include information that addresses disparities, inequities, and access, and special populations, as you guys had just talked a little bit about. Okay, next slide, please. So the first section of the report is, of course, the background, basically the history of the opioid epidemic and the relevant legislation. So we've starred some of the stuff on here that we've already discussed in the prior meeting, but I might still go over it to give you a good picture of how it's filling out. Section 2, like I mentioned, the methodology is the scoring rubric. So we have looked at the impact, the feasibility, and the criticality of the different recommendations that have been made up to this point and that we can contribute as well. Yeah, so the scoring rubric for that, like how that was developed and how it's used, is going to be in the methodology section, as will all the reports we looked at for this and all the process that we went through to come up with this paper. And then the third section is opioid impact. So like before, of course, the overdose death rates, the SUD rates, stratified where we can by population demographics, looking at health equity where that's available. And then a lot of what we've added since our last talk is talking through the data availability, consistency, and robustness, because it can be a little bit difficult sometimes to pull everything together, and you notice gaps places, or you notice where data maybe isn't as robust as it could be. Maybe a survey of 30 people where we really need, to survey more people about the topic, that kind of thing. So we note in the report where those opportunities are for the future for Nevada. And then from your suggested topics, we do have regional level data stratifications. And we also hit a little bit harder on that juvenile substance use and overdose rates and risk factors. So next slide. The fourth section goes through kind of the things that go along with the opioid issues. The rates of polysubstance use, co-occurring behavioral health and physical health disorders, suicide, and in addition, that mental health disease specific rates. So there are some specific rates around, as I mentioned, behavioral health and opioid use disorders. So we go into a little bit more with that. Section 5, we've labeled risk factors. So we look at both system level risk factors and individual level risk factors. We look at regional disparities and challenges. We also, I haven't listed here, but we also talk a bit about treatment access across different areas and populations. Workforce shortages are a huge conversation when it comes to a systemic risk factor for it getting worse. And then again, those co-occurring conditions. Suggested topics that you gave us, again, that's where that FQHC MAP model is. That's where we have a huge section on ACEs, oh my gosh, I blanked on it. The childhood trauma, adverse childhood experiences, ACES. Huge section on that and how it impacts risk for opioid use in the future. Harm reduction, education, and again, accessibility of care when it comes to time and distance from people in various parts of your state. Next slide, please. Section 6 actually goes over Johns Hopkins best practice recommendations, because it is incredibly important that there is some evidence that what we want to do works, right? We don't want to kind of guess or put resources into something that isn't at least tested or somewhat proven that it can actually have an outcome and it can have the outcome we're looking for. So Johns Hopkins has done a wonderful job of summarizing some of the best practices within opioid responses. So we have a whole section on that to help educate everybody on what we think tends to work by the science. And then finally, section 7 is the recommendations, and that's where the detailed actionable recommendations are going to be listed. We don't necessarily set those priorities. We are going to offer you guys a scoring rubric, and we're going to put scores on these different recommendations based again on their feasibility, how critical they are, and how impactful they can be. So as we offer those to you, then you can go back and prioritize those yourself. You can take a look and say, well, you know, this is highly critical, this is very feasible, but really expensive, but let's do that one. You know, we're not going to make those calls on what you should do first, but this should help you compare all the apples and oranges out there with respect to recommendations. So next slide, please. So any questions, and I would probably have maybe Dr. Woodard help me if that's okay, in addition to my team, if some other questions come up that are a little more difficult.
I see Lisa Lee's hand up.
Oh my goodness, Lisa Lee for the record. Thank you again for entertaining a question. Dr. Cantrell, beautiful presentation. I'm always impressed with you and your team's work. One question on the trauma issue is something I've seen a ton in Nevada, especially working with women who are incarcerated, is historical trauma. Nevada does have a history of Indian boarding schools. And there are, you know, based on my experiences serving women who are justice involved, historical trauma really plays a big factor into intergenerational alcohol and substance use. And I would feel bad about myself if I didn't mention that here. And I think for so many populations too, definitely migrant populations. And we do have a bit of diversity, not as diverse as other places, but I do think that historical trauma and cultural frameworks of how to cope with those traumas do play a part. And I didn't see that listed, but I did want to draw attention to that being a factor, a risk factor. Thank you so much. You're awesome. Thank you.
Well, thank you so much.
Thank you, Lisa. Any further comments on this issue? Raise your hand, please, or go ahead and chime in.
Jessica Johnson in Vegas has a comment.
All right, Jessica.
Thank you, Chair Ford. Jessica Johnson for the record. Dr. Cantrell, is there I know you probably have a timeline of next steps in this with the report outlined here. Do you have a date yet of when this might be completed, or I'm just curious about the next steps for this process after today's meeting?
So do I need to be recognized to answer or no?
I'm sorry, no, ma'am. Go ahead.
Okay, just make sure. Thank you.
Yeah,
Sorry. Okay, I'm awful at that. So Courtney Cantrell for the record. Actually, I'm gonna, if it's okay, ask Jordan Bublik to answer that question for you, because I don't have the time frame, and she's our project manager especially. So I think she has a better idea of what the next steps and timing is.
Sure. So this is Jordan Bublik for the record. I can speak towards our next steps as far as getting our draft and working with DHHS to finalize. And that'll be going on over this next month, but I would defer to Dr. Woodard on a final date of when we would provide this to this committee, as that would be in her realm.
Sure. So Stephanie Woodard for the record, we're looking.
No, we're on.
Good, thank you. Stephanie Woodard for the record, we're looking at May to have everything completed. So just as a reminder to the committee, not only do we have the review of all of the information and data that Mercer has presented here, but there will also be additional qualitative data that will be brought into the needs assessment and integrated into those recommendations. So we're really trying to use the best practices for a more mixed methods approach, and making sure that we also are including individuals with lived experience and their voices into the report for consideration. So we have slowed down the process. We've actually sort of taken the opportunity to extend our timeframes just to make sure that we have ample opportunity for sufficient outreach into communities across Nevada. UNLV and the Minority Health and Equity Coalition have been partnering with us to do a process called the community-based participatory research. And so we are using that as our framework. So we have slowed down our process a little bit just to make sure that we have enough time to gather that information for consideration and inclusion. So ultimately, we're looking at May to be able to have the final draft of the needs assessment, and then we will be launching into developing the state plan from there.
Thank you, Dr. Woodard. That's great. If I'm not remembering this correctly, in April, my office is going to be getting y'all some money sitting in that bank from some of the opioid settlements, $50 million or so. So by the time May comes around, y'all have something to play with. All right. Further okay, Lisa, go ahead.
Thank you for the record. I just wanted to say something about that UNLV call for participation. The way I received it was a day in advance of those focus group sessions, which was not enough time, especially when you think about people who have a chaotic relationship with their substance use. A little bit more lead time before those calls for qualitative data collection would be much appreciated. I don't know who to tell that to, but I'll just leave it. I'll lay it here that when you're wrangling people again with some chaotic things going on in their lives, a little bit of lead time is so appreciated to make sure that they have adequate access to technology and a Wi-Fi connection and all of those things. There are a lot of considerations. Thank you.
Thanks, Lisa. Duly noted. Any further comments, questions on this agenda item? I see a hand up. Yeah, go ahead, Jill.
Chair, Jill Tolles for the record. I just wondered if this is amazing, and I can't wait to read it. And I noticed that section 7 has recommendations, and I just wanted to give Dr. Woodard a chance to explain how those recommendations work in light of the recommendations we will be working on with our working group, so that we can make sure we're coordinating between the two.
Sure. So Stephanie Woodard for the record. You'll recall some of the initial conversations that we had with this committee was how the two pieces of legislation really worked hand in hand with one another to make sure that we had sort of a feedback loop between both the ACRN and DHHS proper, as well as this committee. So as the subcommittees are developing their recommendations and those are vetted by the overall committee, those recommendations will then go to DHHS for additional consideration and potential addition into the state plan. I also wanted to just mention that off of the recommendations, again, there will be a prioritization process and then the state plan will be drafted. But this committee will have an opportunity at our next meeting in June to be able to review that state plan and provide any feedback prior to that state plan being finalized. So lots of opportunities, very intentional synergy here to make sure that this committee is not only brought up to speed as the needs assessment and the state plan are being developed, but also that there's an opportunity to have influence over those processes to make sure that we're getting your feedback incorporated in the most timely way possible.
Anything further?
Deb Nadler had a comment.
Go ahead, Ms. Nadler.
Just one quick comment on your needs assessment and everything that you're doing. Thank you so much for doing an awesome job. I just had a question about the fentanyl in the kids. Are y'all doing something specifically on the needs analysis based on the 12, 13, 14, 15-year-old kids that we are losing in this state, because it's more than tripled in the past, since 2019, I'm going to say. I just want to make sure there's something specific on the fentanyl, because these kids don't know and the parents don't. Parents have no clue. So
Yes.
if you could do something with the fentanyl specifically too, I'm sorry. Thank you.
I'm sorry. I thought I can't quite see you because I couldn't tell if we're done. Yeah, we definitely have recommendations around harm reduction in general, and a lot of the recommendations are specific to different groups. So, and if once we're done, as she said, there's opportunities to give feedback on things. If there's something you're finding that's missing in there, you'll have an opportunity to give feedback as well. But yeah, it's a long report and there are so many recommendations. I don't remember specifically exactly how we're wording them or how they're looking right now. But definitely fentanyl is a big part of some of the recommendations in there for harm reduction.
Thank you. Okay. Senator Ganser, do I see you? Oh, sorry. Okay. Let's move on then to number 7. Oh, wait a minute. Is that an action item? So do we need to take an action on this? Someone please help me out on this. No, Rosalie, you shaking your head? We're good. Okay.
You're permitted to take an action, but it does not have to. If you don't have an action to take, you don't have to. Do
I didn't think so. I think that this was for presentation purposes. All right, moving on to number 7, review and provide feedback for revised bylaws for the SURG. Let's see who's supposed to talk about that. That's going to be Dr. Kearns.
Yes, thank you. Terry Kearns for the record. And before you can move to the next slide, I first want to acknowledge Lisa Lee's comment on changing the intravenous drug users to people who inject drugs. We had made that change, so I apologize that fell off. The next one is, if you go to Article 4, membership and terms, Section 1 members, these were all highlighted, so they should be highlighted in your copies that you got. This, as we went back to the legislation, and Lisa Lee had recommended this, that all of our members their terms don't end at the same time. And our legislators had addressed that. So we went back and looked at the legislation, and you can see the initial term expiration on the first 11 members would be January 1st of 2023. And then the last 7 members' terms would end on January 1st of 2024. So we made that change within the membership and their term expirations. And then the next one is Section 2. Right under those is we just added 700,000 or more in 2A1. It just had said up to 700,000. So we added that or more in that part. Then if we go to the next slide, on this slide, this speaks to our subcommittees. In our prior bylaws, it said that we would just have one subcommittee that would make recommendations on regulations, which is not really the scope of what this group does and is tasked to do. So we changed it to address the subcommittees as we see that we can have up to 3 subcommittees, which is what has been the recommendation that we discussed earlier in this meeting. The subcommittee will have a minimum of 2 voting members from the overall working group. Each subcommittee shall have 1 chair who is a voting member of the working group, which we've already approved. The working group chair, Chair Ford, would appoint the subcommittee chairs and members from the working group. That recommendation was made, and again, we approved that. Then each subcommittee through subcommittee chairs may request presentations from subject matter experts as needed based on their area of expertise and or specific projects. These subject matter experts that are brought in would not be non-voting members, but would be subject matter experts asked to present on something. And that doesn't mean they cannot attend all the meetings. If they want to attend, they would just not be considered a member. And the reason for that is just so that we don't have any issues with quorum. So each subcommittee member will serve for 1 year. After 1 year, the SURG chair would determine if the subcommittee needs to continue for another year. And if needed for another year, the SURG chair would appoint the subcommittee chair and members from the working group. The subcommittee chair would report back to the working group on the activities of the subcommittee and recommendations from that subcommittee. And then the number of working group members serving on a single subcommittee cannot be equal to or greater than the quorum of the working group. And the working group members are limited to serving on one of the 3 subcommittees, which we have addressed all that prior to. And then next slide. Oh, I apologize. Can you go back? I accidentally put on here that the SMEs would be non-voting members, but they will not be, is what's in here. So I apologize. Next slide. And then the last one was on proxy. And if someone has a proxy attend, they cannot vote for the member that they are attending for, and they would not be considered in quorum. So those are the changes that we have made. And thank you, Lisa. We'll make that one change that wasn't in this copy that you noted. I'll tender it back to Chair Ford.
Thank you so much. Let me open it up for comments, questions, concerns, complaints. Going once before I call for a vote to approve these amendments. Okay, then I will entertain a motion to approve the amendment to the bylaws. Hello, I saw Christine come off mute. Christina, are you going to make a motion or make a comment?
I'll make a motion.
Oh, very good. I have a motion. Do I have a second?
This is Jeff Iverson. I'll second.
Thanks, Jeff. Good to see you. At least your name. All right. We have a motion and a second to approve the amendment to the bylaws as presented. Any further comment on this motion? Hearing and seeing none, all in favor say aye.
Aye.
Aye. Any opposed? Any abstentions? Motion carries unanimously. Thank you so much. Great work, Dr. Kearns. Okay, that was number 7. We are now at number 8, review and consider items for June 7th, 2022 SURG meeting. Dr. Woodard, mic's yours.
Stephanie Woodard for the record. So this committee now has the opportunity to set forth the agenda for the next substance use, the SURG meeting, scheduled for June 7th of 2022. Just been taking notes during the meeting today and would note that we likely would want an agenda item specifically for a report out from the subcommittees, anticipating that the subcommittees will have met at least once, if not more, between now and the June 7th meeting. So I have that down. In addition to that, we would likely want an update on the needs assessment, since the needs assessment would be finalized by the June 7th meeting. We also could entertain the opportunity to review the drafted state plan for feedback. We may also want to agendize any additional updates from the advisory committee from a Resilient Nevada. So I just wanted to put those out there as potential agenda items, and would certainly look to this committee to see if there were any other items that we would want to have on the agenda.
Prerogative and say, please do include everything you've just mentioned on the next agenda. And I'll likewise suggest that we get an update from my office, Bureau of Consumer Protection, and Dr. Kearns, to the extent she wants to be engaged in it, on the opioid litigation and settlement funds and distributions. Just an information item, wouldn't be anything for us to vote on, but by June, we will have gotten additional monies in from settlements. We could figure out where, maybe get reports on whether it's been distributed, how much counties have gotten each, and things of that sort, because I think we're going to start seeing some substantial benefits associated with these settlements coming in. So let's add that to the agenda, okay? All right. Any other agenda items for interest?
Deb Nadler has a question.
I'm sorry. I promise I will not talk. This is a quick question.
Go ahead.
This is Debbie Nadler. As far as the settlement monies that are coming in, I was reading somewhere that, and I probably read it wrong, that we only got, the state of Nevada, only 44% of the funds. Is that correct? Or were the funds going somewhere else? Were they being generated elsewhere? And how much did the attorneys get of the fund money? Is that a legal question for me to ask?
Sure. Sure, you can ask that question. There are attorney's fees associated with the recovery, to be sure, but 44% is not the gross that we've received. Their attorney's fees are capped by statute and by contract, and that's for the state, but also for the municipalities that have retained lawyers as well. I believe the bankruptcy court, the MDL court, as they call it, had required a reduction in fees for municipalities under some particular settlements. And so, yes, absolutely, attorney's fees will be paid, and the crux and the net of that money is going to be what's delivered to the state and to the municipalities for distribution.
And the last question is, do we settle with Purdue?
Kind of. They're in bankruptcy. And
yeah, I know that.
Yeah. So can I talk? Rosalie, it's cool for me to talk about this, right?
You can give you guys aren't, it's giving an update.
Okay.
Don't get into deliberating on anything to do about it, but you can give some update.
All right, very good. Yeah, so the Purdue settlement, so the short answer is yes, we have, as a state, endeavored to settle with Purdue. Purdue had a plan that had been approved for settlement. A handful of states opposed that plan, and so they appealed the lower court's decision to the next level. And the next level agreed with them on that appeal, which sent them back to the drawing board, Purdue back to the drawing board. And my understanding is that as of last week, there's a new deal that's been concocted, but there are some objections to it. So we're not quite done. We thought we had settled, but there are some objections from other states with regard to some of the back and forth on monies and things like that. So the Sacklers have agreed, which are the billionaire owners of Purdue, to add an additional $1 billion to the amount of money that was initially agreed to in the settlement because of the appeal. But there's some objections to how that money is going to be divvied up. So probably too much in the weeds, but yes, we tried to settle. No, it's not a done deal yet.
Okay, thank you.
Okay, Lisa.
Lisa Lee for the record. I just want to echo what I said at our very first meeting. Homework assignments for everyone here, if you so choose to read Unsettled by Ryan Hampton. He was on that bankruptcy committee. Highly recommend this book if you are interested in learning more about opioid litigation and some of the things that happen behind the scenes. The other recommendation is a book by Beth Macy, or if you want to fast track this and skip the reading or Audible, you can watch Dope Sick. It's available on Hulu, but it's based on the book and it's very, very comprehensive. So I highly recommend that if we are having conversations around this phase of the opioid crisis, that we do our homework. Thank you.
Thanks, Lisa. Chelsea.
Thank you. Chelsea Cheatham for the record. Correct me if I'm wrong, but I think I remember at a previous meeting, we had talked about having each of the subcommittees have a subject matter expert do a presentation to the group during the meeting. So I wasn't sure if that's something that we wanted to add to the next agenda, possibly assigning one of the groups to have a subject matter expert present.
I was off mute, then I muted myself to start talking. So I'm gonna say a thing and then I'm gonna give it to Jill because she may have a different opinion on this. It seems to me that we just finally got our subcommittees created and organized. We should give them an opportunity to do some work before we bring in a presentation from them on this issue. That's my perspective, but maybe Assemblywoman Toles has a different perspective, or someone else does. I see Dr. Woodard has her hand up.
Yeah, so Stephanie Woodard for the record. I was going to mention this in public comment, but it seems relevant here. There was an interim committee, a legislative committee on health meeting in February, so February 17th. And during that interim committee, we actually had several representatives from the SURG as subject matter experts provide some pretty extensive testimony. So I would turn everyone's attention to the recording of that meeting so that we don't necessarily have to burden all of those SMEs to come back to provide similar presentations. But the depth and breadth of the information that was shared during that meeting was incredibly extensive, along with some recommendations for some potential policy or funding for the future that certainly the subcommittees could consider as well. So just wanted to make sure everyone was aware that that committee meeting had taken place and that the presentations were very broad and specifically focused on substance use disorder, harm reduction, treatment. There was actually also a presentation on parity. So just wanted to make sure everybody was aware that that download is available for everyone to view.
Cool.
Thank you. And Chair,
yeah.
Chair, I appreciate from Lisa Lee for the homework assignments and also from Dr. Woodard for additional homework assignments. And I have written them all down so that I could be a good student as well. And so I look forward to those. But I would say that the working groups, the way that we've designed this is that that the subcommittees would hear presentations from the subject matter experts and then spend time working through the recommendations. And when the subcommittees report back to the overall working group, part of their presentation back to the overall working group will be what subject matter experts they heard from, and then sharing the content of those presentations with the rest of the working group. And that way we can focus our time in our quarterly meetings as a working group on the action steps that we need to take, as opposed to having, I believe there was initial discussion the very first time this working group met of, do we take action steps in the working group and have discussion, or do we make these all day long seminars? And that's why we landed with having the subcommittees drill down with the subject matter expert presentations, and then the working group is going to be for discussion and action as a whole in the quarterly meetings. I hope that was clear.
Chelsea?
Yes.
All right, very good. All right, any further comments on this agenda item? I see a hand up, Dr. Kearns.
Yes, this is it's a question, I guess, for Dr. Woodard. I know that you said an update from the ACRN for our next meeting agenda. I wondered if part of that would be an update on, I don't remember what number it was, but on the 988 and those crisis response around that. If that is in the ACRN, or if that could be a separate item.
Yeah, that was the same, but they created the Resilient Committee, I think, right? But okay, yes.
Yeah, that's correct. Yes. Stephanie Woodard for the record, probably a separate agenda item because the ACRN is not necessarily directly related to the crisis response account in 988. So we could probably add that as a separate agenda item.
Okay. All right. Yes, I see Dr. Woodard.
And Chair, if I may, because the interim committee on health is continuing to meet, I also just wanted to make sure if we're talking about homework assignments, that their upcoming meeting is scheduled for March 24th. And during that meeting, they will be addressing a whole range of issues as it relates to children's behavioral health. So included in there is some review of data and information related to children's behavioral health more broadly, but then presentations from UNR on adverse childhood experiences and some of the data and special studies that they have done there, substance use disorder prevention for youth, as well as substance use disorder treatment for children and adolescents. So they're going to have a full day's agenda as well, but just wanted to make sure members of this committee were aware, because many of the topics that our subcommittees will be tackling are going to be covered during that meeting as well.
Great to know. Thank you so much for that update on that. Okay,
Yeah. Chair Ford, we'll
Yes.
get that information from Dr. Woodard and push that out to the committee.
very good. Thank you. Any other comments, questions? Okay, I think that was an information item more for us to hear from folks on that. Then we will move on to the next agenda item, which is the penultimate, calling for public comment. Is there anyone in the room who wants to speak on any item, whether it's on agenda or not, for public comment? Anybody down in Vegas for public comment?
It doesn't look like it.
Anyone come to Carson for public comment? Nope. Okay. Anyone on the screen or internet for public comment? Rhonda Fairchild. Go ahead, Rhonda. You can unmute. Someone needs to unmute her, I guess, maybe. But I see her hand up. Go ahead, Rhonda.
Thank you, Chair Ford. Rhonda Fairchild for the record. So I have three things. One, I would like to be included in the subcommittee meetings when they talk about criminal justice. Two, the interim committee on health meetings, do I find that on the DHH website? I know that's a question, but I'm not clear on where to find that information about the February 17th meeting. And then three, as someone who is boots on the ground 24/7, I just want to thank this committee for the commitment to the group. Today, I felt hope and my heart was touched by the empathy that this group is showing. So I just wanted to thank you all very much.
That's so kind of you. You gave me goosebumps with that last comment. Let me tell you, the people on this screen and on this committee, they're about it. This is real stuff. Jill Tolles put in a lot of sweat equity to get this moving, and I welcome Senator Ganser because I know she likewise has a heart for all of this, and my Senate and Assembly colleagues as well. So thanks everybody for being here. I'm going to take the prerogative to say committee schedules are on the legislative website. You can check that out, and you can find when committees are going to meet, including interim health committee. And relative, as are our subcommittee meetings, they're public meetings as well. And so there will be notices that go out detailing when they're going to meet. And so I would monitor our websites. Rosalie, okay, here we go. There you go. There you go. It's on the screen now. Additional information, resources, and updates available at that particular website there. You can go to our website, you can find it, and we'll go from there. So any further public comment? Okay, hearing none. Then
I'm sorry, sir, we do have a public comment in Vegas.
Okay. All right, go ahead.
I'm sorry, this is Debbie Nadler for the record. I knew there was something I was forgetting. Is there any way possible, maybe I can talk to you or somebody else at another time? A lot of states have banned kratom, C-R-A-T-O-M, and it is a very dangerous substance. I know because of my son's dealings with it, and I think we have 10 states that have banned it. I don't know who I would talk to about that, the legislator or whoever, but it's really bad for our kids.
Yeah.
This is.
Go ahead.
I was just going to say, this is Terry Kearns for the record. I do know that the Board of Pharmacy is looking at kratom and whether they would recommend to ban it or not.
Okay.
So it is something that's being looked at through the Board of Pharmacy.
Okay, because I just saw some death. Thank you. Sorry.
That's okay. Okay. Well, thanks everybody. With that, I will declare us adjourned. Have a great rest of your week. Bye, everybody.
About a kratom.
I'm gonna hang this up.
Yeah.